behind the scenes and into the lives of COVID 19 frontline warriors that are relentlessly providing help to people in need during challenging times. We bring to you the stories of the heroes who are going out of their way to provide service during a global pandemic. Our COVID 19 warrior for today's episode is an entrepreneur who is building COVID 19 care hospitals in rural areas in North India. Shriti Pandey's startup Structure Eco manufactures sustainable agri-bio panels. It converts waste agri-stubble, which is usually burnt, into biomaterial that looks and feels just like plywood. Shriti is today using this sustainable and biodegradable material to build COVID 19 hospitals in rural areas in record time. The first hospital was built in rural Patna in under 80 days, and the one in Jalandhar took only about a month to build. We speak to Shriti about her crucial work, its importance, and the challenges and opportunities that come along with working in the rural economy.
So the village where we built the hospital was in a block called Masadi, and that Masadi block is some 80 kilometers from the Patna city. We built a 7,000 square feet hospital, and that we did that in less than 80 days, which included the civil foundation as well with it. So as I said, since we knew we had a very short timeline, so we did a lot of things parallelly. So while the foundation was being built at site, we had like a temporary shed near to the site where we did all the prefabrication of the steel. So instead of individually connecting the members, we made full walls, roofs, and floor grids off-site, like a modular construction, and just got them to connect at site once the foundation was ready. And the panels were also cut to size, sent to the factories from the warehouse, so that it takes lesser time for the carpenters to build it. So we took all of those things in consideration. I still remember the roof that we built there. We only used 2 days to install the roofing panel. So at that time, as you know, reverse migration happened. So thankfully, we were like, where will we get all the laborers from? But at that point, unfortunately, a lot of laborers had returned back from Chennai and Bangalore to that village in Bihar. So it was very interesting. The second day, the doctor just tells us, I think you will get all your laborers in this village itself. Just go around asking. And really, we got all electricians, plumber, masons. So basically, the whole village ended up building it with us. The hospital. It was only 4 of us from my company, but we must have paid around 30 to 35, daily wage laborers for 60 days in a row in a period when they had no work.
In January, they built a 6,000 square feet additional space for Batra Hospital in Jalandhar, which took even lesser time, about 30 days only.
So they were expanding the existing healthcare facility to open, build a 6,000 square feet additional space to have more departments and specializations. So at that point, we built it for them like a regular hospital, stays with, OPD rooms and reception and patient rooms, lab and all. But just a month after my team returned back, because the COVID situation got dire, so now even they are 100% utilizing the whole space as a COVID hospital. And even they are able to, have around 50 to 70 beds there with patients.
Shriti decided to use her background in civil engineering to set up Structure Eco in June 2018.
So it will actually be 3 years for us.
Lovely.
In a month, but the way I see it, it's actually going to be 4 years, because when I did the rural fellowship, which was a year exactly before June 2018, so I got an opportunity to live in a village for a year, which actually coincidentally, got me across the problem, which is stubble burning. Because till then, as most people living in Delhi or in India, you watch this happening over news during Diwali season. And you're like, okay, this is a local problem happening in Punjab and Haryana. Yeah. I saw in Madhya Pradesh, in a village, people burning soya stalk and wheat straw, not paddy, which we are used to believe. So that's when I got interested, and I realized that it's actually a global problem and there is no usage to it. And India as a country manufactures 500 million metric ton of this straw. So then I realized that it's a huge problem, and if people in a tribal village where they have, they were all marginal farmers, they were burning it, then it makes sense that in a state like Punjab, where they have much bigger lands and they don't have time to clear it, they end up burning it too. And no matter what government subsidy, unless there's a value attached to the straw and someone is willing to pay for it, which in this case is like right now our organization, they're not going to stop burning it. So that's where I came across the problem, and then of course my background in civil engineering and construction management helped me think that we can convert it into a biomaterial. We now 100% locally manufacture panels made out of agri waste. In the look and feel, they are very similar to how you would look at a plywood. So like the way you buy ply for your house to make furniture and table, but these panels are far more dense than ply, and they are also fireproof. So what we do in our case, when we are building a complete structure using this material, this panel substitutes the brick part, and the concrete is substituted by hollow steel frames. So in totality, you're building a very lightweight structure that is faster and in a modular fashion built, and happens to be sustainable.
Structure Eco has tied up with organizations like Selco Foundation and Doctors for You to build some of these hospitals.
We, from the very start, partnered with certain organizations like Selco Foundation, which is based out of Bangalore, which is one of the biggest NGO in India that provides clean energy, solar, electrification. So the reason we partnered with them was to be able to learn how you can work in a rural condition, because it's not the same. It's not just about the material anymore. It's about the community. It's about how you build in a place where it's very difficult to send a truck, where there's not even proper road. So, so understanding those issues, we had some experience to when we were told, when we were asked that if we can build a COVID hospital quickly, we knew that we can do it in the middle of nowhere and 100 kilometers from the main city, because we knew how to work in that geography with no electricity.
They are now looking to build hospitals that can be dismantled post the pandemic to make smaller primary healthcare centers across the village.
Most of the governments have requested us to give a solution that is slightly semi-temporary, with the mindset that hopefully we would not require that as a COVID infrastructure in next 6 months, let's say. But you don't want to leave that to waste, right? That whole big structure. So the idea is that most of these districts where we have given the proposal are in the outskirts, like in Jharkhand, Bihar again. So a lot of these structures will be refurbished into, adding to the non-available health infrastructure in these areas. So like you could, like yesterday only I was giving in a proposal to Agni Mission of the government. So we were talking about it that, if we build a 200-bed hospital, let's build it in a way that is dismantleable. And you can then make smaller PHCs, like primary healthcare centers, out of the same amount of material. So because a 200-bed hospital will take easily 8,000 square feet, it can easily be, broken down into smaller pieces and at least be like 10-15 PHCs.